All right, good morning. Welcome back to The Link. Pacific Points, Cabo Enterprises, ITD, and Jack in the Box. Let's go in and bring on our house doctor, Dr. Hoa Nguyen, our COVID consultant, if you will. There's a former chair of the Physicians Advisory Group. Good morning, Doc. Thanks for joining us.
Good morning, guys.
The doctor is in, and Doc, just looking at the numbers over the last week, I know we last spoke about a week ago. We are seeing lower case counts, but with the positivity rate still pretty high. But what's your take on what you've seen over the last few days?
I think that we're going to go up and down probably the next few weeks. So I know that we have a lower number now in the past day or two, but I think it might bounce up a little bit more before it's coming back down. So we really can't predict this one so far. Like I said, we are so far kind of different than the state. So it's kind of hard to predict. It's going to go in the downward trend, or we're going to plateau for a little while before we go back down.
Doc, what about this physician's advisory that come out relative to the MIS? We did hear that there were a couple pediatric admissions. What are you seeing or hearing, or what are parents saying at the clinic level?
The parents are worried. I always tell the parents before is that really the overwhelming majority of kids, they don't get in trouble at the time that they get the infection. But what we're looking for is the symptom they will have several weeks after infection resolve. So that's what we're looking for. And when it takes us this far down the road to get 2 or 3 cases in the hospital, but as the number of the peds that turn positive coming up, we will have to really look forward to see if make sure the physician kind of aware of the syndrome and identify them in the future, because there's the more positive in the children, the more likely that we will have an increase in number of the MIS-C in the next few months.
What did you make, Doc? There was a town hall presentation with public health relative to this physician's advisory that was sent out, and it was revealed that we don't have any treatment for this on island.
Yeah, the treatment IVIG, and that's pretty rare, and I'm not surprised that we do not have it on the island right now, because that's something that we don't use often. So I think that they expect to have a shipment coming in for IVIG this week. So hopefully, we will have on the island for the future. But it's across the United States. It's a shortage. Again, we don't stop those things and keep those things for a long time. So there's no one to blame on that one. It's just that we run out, and hopefully come in soon this week for the kids.
Doc, you were coming on here a few weeks ago and you talked about the gaps when public health identifies a positive, right? And you had raised concerns about what are we doing to reach these positives, because we had seen some deaths reported where these COVID-related fatalities were known positives, meaning public health knew they were positive COVID-19 cases, which begged the question, did they do enough to reach out to these people? That's been a few weeks, right? And we're starting to see the DOAs kind of tail off a little bit. Are you now satisfied with the effort public health's making? What have you heard in terms of them reaching the positive cases, and in terms of them getting those positives to do the Regeneron or Regenco treatments?
We still behind on reaching out to the positive and notify them regarding the isolation and contact tracing. But again, those will be right now at this point, because we have so many, be selective contact tracing at this point. But regarding the Regeneron the treatment, I think we do a much better job now regarding identify the high risk and refer them to the infusion or the treatment in Manila. So I think we do much better. We still have a few places that do testing and still not refer patient to the center yet. But I think that they are working on them to make sure that those places identify the high risk and refer them to infusion center. I think the more knowledge out there for our population to know that the treatment is available if they want it, it's better. I think our people know about a lot more now. So even if the center don't refer to them, they can still self-refer to the center for the treatment. So it's good. We just have to keep on message out there for the population and make sure they're aware of it. We're going to still have some DOA, unfortunately, because people are still not everyone that we were able to reach out 100%. So I just again, Chris, the show like this will reach out a lot more, and we just have people to pass out word of mouth that hey, you got to come in early.
Yeah, that's always been a struggle is trying to get the not just the right messaging, but to be consistent with that
Yes,
messaging, Doc. And so you're saying that we should still be telling people don't wait until it's too late.
yes, definitely. And I tell you, well, with the message out there, I'm glad that Dr. Ann did her number, and as it showed, just like we expected, the vaccine are weaning off, and right now the average was 4.5 months, so that's a lot shorter than we thought. We thought about 6 to 9 months, but for whatever reason is, we are at 4.5 months. So I would highly encourage people to get the booster. I would say forget about the priority at this point. If you are anywhere from 4 to 6 months out of your second dose, go somewhere and get the booster. You know, but it's not that we are in any shortage of booster at this point. So I would say that if you are 6 months out, to try to make an effort as much as possible and come in. There's multiple sites to get the third shot. So I would say please come in. I would ask the site that do the booster to kind of relax the criteria and let people have the booster if they need to be, if they want, if they 4 to 6 months out, because like I say, the data they have right now is about 4.5, so 4.5 months. So you can get an infection already.
I saw that, Doc. Just to be clear, right? So, for example, in my case personally, I took the Moderna. Well, I didn't take it. You guys gave it to me. Second shot was, I think, in March. So I don't even know, and I should know. I don't even know the criteria for the third shot of Moderna. But for example, I'm 47 years old, pre-hypertension, early stage diabetes. Am I eligible to get the third shot, or who is?
So right now, Christmas, if you follow the criteria, you're not going to be able to get it yet. Just because you don't have the comorbidity at this point. The comorbidity is basically from 18 to 50. You should have the shot. But right now, like I say, all the breakthrough right now that we see, including the clinic, a lot of people don't have no comorbidity, but they still have a breakthrough infection. So, at this point, when the data come out to 4.5 months that you can get infection, yours in February, Christmas, you walk to the clinic, I would give to you already. I would highly encourage that. I know the Moderna just recently got approved by the FDA just past Thursday. So it's approved for half of those. So they should be given at this point and not follow the criteria so much. Like I say, Guam is somewhat unique because our breakthrough rate is a lot higher than the state. And so a lot shorter in the time frame for the immunity. So I would say that hey, if you should be able to get the booster if you want it.
Right on. Well, Doc,
Yeah. the key here, Chris, to encourage as many people come out to get the booster as much as possible, right? But I know the booster is kind of slow. It's we have 3,000 people now. We should have a lot more people to get the booster at this point. So all the people that in December, January, February, March should be out right now to get the booster ready. But I think it's take off a little bit slow. So the message out there should be encourage people to go in and get the booster.
Yeah, I mean, Doc, I got to say that we've been talking about the booster and when are we going to roll out the plans for the booster shot for months here on this show. I remember asking you about this, God, in like April or probably earlier. So, yeah, it's all in the planning. And what, in your opinion, if the booster shots, the numbers are low and you think we should be seeing more people who've gotten the booster ready, what do we need to do better?
We should tell people to come in and get a booster. I have a patient come in last week, and she showed up to one of the outreach clinic, and she's a week earlier than 6 months, and the outreach won't give to her a week earlier, and to me that's a shame. Uh, just give it to them when they're there ready. She might not come back in a week from now. It doesn't make any sense. So if they show up to your outreach clinic, give to them. It doesn't matter a week, man. That's so it's it doesn't make any sense. So whoever make the decision should be, if they show up, give to them. And that's how we protect our community and those breakthrough case at this point. So like I say, just give and be liberal to it. We're not short. I tell you, in the state, you show up somewhere, you want the booster, they give it to you. There's no question asked. You can get it at the airport, you can get it at the mall, you can get, anywhere you go that they have a
I think
booster.
they even got it at Starbucks, Doc.
I know. So if our people want it, give to them. Because like I say, the data show 4.5 months. Doesn't matter your comorbidity or not. And remember, the young people from 18 to 40, they don't have comorbidity. So if they want to give to them, the only way you protect them from bringing home their parents.
Yeah. Thank you, Doc, for your words again this week. And that's our assignment for this week, guys, from the Good Doctor. Go out and get your booster. Talk to your doctor about getting the third shot of Moderna if you got the Moderna vaccine. Right, Doc?
And yes, that's exactly. And Chris, for the parents to think ahead of time, FDA going to meet at the end of this month on the 5 to 11, and most likely they will approve the shot from 5 to 11 for Pfizer. I would encourage the parents that have kids 5 to 11 to get the shot.
Thank you, Doc.
Okay.
Appreciate it. There you go, Doctor.
Safe.
You too, Doc. Always. Dr. Hoa Nguyen of the American Medical Center is also the former Physicians Advisory Group chairman. He advised the governor throughout, well, I want to say about 80% of this pandemic before leaving his post over what he called political interference. So we're always grateful to get him on.